Yet Bennett, everyone. Welcome to Facebook Live. We're very happy to be here with you now. We have members of our team here, member of our board as well. Maybe we'll go ahead and start with introductions. First, just so you know, today we're going to give you guys an update on our ongoing relief efforts so that folks can know what we're doing right now. As many of you know, we wound down our relief efforts back in July, but we've had to resume those. I'll give a little more detail on that here in a minute. So we just want to let people know what services are available through our organization right now. And then I know COVID, especially Delta variant, is impacting other tribal communities pretty tremendously right now. And we've had folks reach out to us asking for kind of guidance on how to organize their own relief effort. And so we're hoping that, those folks can turn to this video as a tool to kind of understand some winning components to a successful relief effort. Especially like you'll see that we're trying to stretch limited resources and be even more focused than we were before. But before I get down the path of starting this, She'e Ethel Brand Shinsha, Nipotwitli Nishle, Nakai Bashish Chi, Sitnajeni Dasha Che, Don Nakai Dashanella, Sezizi Denasha, Kintana Kehashte, as you can see in the background. And I'm the executive director of the Navajo and Hopi Families COVID-19 Relief Fund, which is a DBA of Yeha Olmido. So I'm happy again to be here with you all today. And I'm going to turn things over to my deputy director, Cassandra Begay, to introduce herself.
Thank you, Ethel. Good morning, everybody. Well, I guess it is noon. The day has been going by really fast. Thank you for joining us today. We're excited to have this conversation with you. Cassandra Begay and Shiat Najani and Shle Nakai Bashishchin Toriji Dashake Nakai Dashanella. As Ethel mentioned, I'm serving as the deputy director, and today I'll be talking about the PPE distribution program as part of our relief. So I'll go ahead and pass it on to our board member, Vanessa Tully.
Yat Vanessa Tully and Sha Kia Ani Nishlan, Tutnazani Bashishchin, Twitzlani Dashache, Tolini Dashanala. Good morning, good afternoon. My name is Vanessa Tully. I own and operate Ahia Shidina Home Care. In addition to that, I am the Ye Halanido board treasurer, and more recently, and actually for the past year and a half, I've been a volunteer for the Navajo and Hopi Families COVID-19 relief effort. I'll go ahead and pass the mic to Mary.
Good afternoon. My name is Mary Francis, and I am the Direct Relief Program Manager, and my clans are Ye'idaneta Chitni, born for Tabaha, Lokat Dashiche Do Izitlan Dashanale, and very happy to join the team here today. And I've been a volunteer before the from the start of the organization. So I'm very happy to be here with the team. I'm going to go ahead and pass it on to Shandine.
Yad She'e Shandine Herrera Yanishia Touching Yanishla Nakai Bashishim Bitani Dashiche Nakai Tashanella Tsebian Ziskai Danasha Nadine Nakai Hotel Aiden and Nishla. Hello everybody, really excited to be here with all of you today. My name is Shandine Herrera. I'm currently the director of the Sky Community Center here in Monument Valley. But relaunched a relief effort over the last few months. I've also been helping with our Delta Relief Program, assisting with deliveries and shopping here on the ground. So I'll be happy to share more on that a bit later, but I'll go ahead and pass it on to Wendy.
Yat Wendy at City Yanashia Toricini Nishli no Ashibashichin. I'm the program manager for public health education here for the organization, and happy to be here. And I will share more as we continue with our session today. Yeah. Let me pass it over to anyone else that didn't get time to introduce themselves.
So sorry, I was on mute. But I think everyone had a chance to introduce themselves. So thanks everyone for your introductions, and thanks to everyone watching and listening. We're so happy to have you here with us and excited for you to understand the resources that we can make available to you and your family and to loved ones in our communities on Navajo and Hopi nations. As you guys know, we started our relief effort on March 15th of 2020, 2 days before the first case on Navajo Nation was identified in Chilchimbatoa. And that was actually the first day that we brought food up to Navajo Nation in the back of a flatbed. One of our board members drove it up, and Vanessa was out shopping on day one, essentially, down in Phoenix, trying to bring food up north to our loved ones. And we've been going pretty much nonstop since then. The middle of April, we were able to access our GoFundMe dollars. And so we started bringing $100,000 to $200,000 worth of food, water, and PPE up to our communities each week through late March of 2021. And then we kind of started to scale back. COVID was quite a bit more under control in our community at that point. A substantial portion of our community, especially our most vulnerable, had accessed the vaccine. And so we were seeing the numbers drop. And so we tapered off our efforts and wound things up around July of 2021. But in that first phase of relief, we were able to mobilize almost 1,300 volunteers. So thank you to all of you volunteers. Many of them are here on this call with us. And we were with this huge team effort, we were able to bring about 500,000 Navajo and Hopi families food, water, and PPE all over Navajo and Hopi nations, which is an area about 27,000 square miles. Which is roughly the size of West Virginia. It's also equivalent to the combined size of Massachusetts, New Hampshire, and Vermont. Also, for you international folks, especially our Irish friends listening, about the size of Ireland. So, this was a monumental effort to get these resources everywhere they needed to go, especially when the nation was experiencing these supply chain disruptions. But thankfully, through Vanessa's relationships with Shamrock Foods, we were able to have a consistent supply of food, and then collaboration with sovereign partners, pretty easy access to hard to secure PPE and hand washing stations, things of that nature. And so all told, in that first phase of relief, we were our volunteers, we had volunteer seamstresses all over the country, and they produced over 113,000 masks, surgical gowns, and other equipment for first responders, medical staff, and our Navajo and Hopi families. And Anti-Sewing Squad was a big part of that. They have an amazing volunteer team out of the Los Angeles area, and I believe those folks are located all over the country as well as Native Nations Sewing. Very thankful to them. And then, those folks brought in an additional 100,000 masks and PPE and in-kind donations. And then, we were able to provide 897 hand washing stations to families that lacked indoor plumbing. We started to understand more specifically the absence of hand washing opportunities in homes and the connection to the spread of the virus. And we were identifying some communities. I mean, you hear that Navajo Nation has 30 to 40% of homes that lack access to running water. and Hopi has similar statistics. But what we were actually identifying with our constituents was that some communities had over 60% of their community that didn't have access to indoor plumbing. So it really varies by region, and it can be quite a dire need. And then we were also able to provide home heating resources to over 4,000 households with elders. And so, you know, we successfully closed out that effort. And meanwhile, we were watching what was happening with the rise of various variants. And we're tracking the case data at Navajo Nation closely to sort of observe whenever something was happening and that we might need to respond again. And unfortunately, you know, Delta variant was sort of the impetus for a new surge in our communities. We started seeing the doubling of cases, weekly new cases on Navajo and Hopi in July and August. And we saw, you know, 1 week where there were 421 new cases, which was way high. I mean, we had dropped down to single digits back in June. So we felt like that was an alarming occurrence, and there was a strong need to try to clamp down on that virus in some way, or be able to help families that were in need. And by helping those families that were in need to stay home and sort of weather out their symptoms, we could also contribute to preventing community spread, and hopefully eliminate the threat before it secured too much of a foothold in our community. So on September 1, we launched our Delta Relief Program. You know, we have folks here who are going to share a lot about what that program does. And, you know, we do have an ongoing crowdfunding platform on GoFundMe. People can continue to give, and we were so thankful for the donations that were made for Indigenous Peoples Day, during Native American Heritage Month, and on Giving Tuesday. So thank you everyone who donated. You know, we really rely on you folks, individual, good-hearted people of this nation and this world, really, because we certainly have not received any support from any governmental source. So individual good people caring about our communities has really fueled our work, and has brought in other donations from foundations as well. So thank you for that. And I'm going to go ahead and pass things over to Vanessa to tell you a little bit about our Delta Relief Program and how folks can access help through that program, and how that process of help requests starts. And then she's going to hand things over to Mary, who will talk a little bit more broadly about the program and the dispatch of relief. And then we'll hand things over to Shania and just kind of keep the conversation going from there. Vanessa? Vanessa, you're on mute. Oh,
Am I still on mute?
no, you're good.
Okay. I'm toggling between screens here. I'd like to show you guys how high-tech savvy I am. Thank you all for having me. Thank you, Ethel, for that introduction. So basically, I've been volunteering with the relief effort since the beginning. I started as a shopper. You know, my biggest concern was making sure that we were doing things in order to be proactive against, you know, the oncoming disaster of COVID-19. You know, if you would have asked me on day one, did I expect it to last this long? No, I didn't. And, you know, Navajo Nation and Hopi communities are very lucky to have, you know, Ethel advocate for them and create the GoFundMe on their behalf. We've been able to accomplish a lot. And right now, we're just preparing for another variant. So I just want to share that we are here, we are available to help. If you and your family are isolating, or if you've heard about our vaccine campaign through advertisements on the radio or social media, our number is here. So you can give us a call. It is a toll-free number. Unfortunately, at the moment, we're only able to provide COVID isolation kits to those that live across Navajo and Hopi. And we're offering that for people that have to quarantine or that are in isolation. So basically what you'll do is you'll give us a call, and I'm going to try to show you guys our website. So hopefully, is my screen sharing? It should be, right? You guys can see my screen?
It's shared.
Okay. So on our website, NavajoHopiSolidarity.org, if you go under programs, you can come to the isolation assistance to create your own request for an isolation kit, or you can sign up for the vaccine campaign. For the isolation kit, this is the form that we fill out when you give us a call. And basically, we just want to get an idea of the size of the household we're assisting, whether or not you guys have all been vaccinated, and then also, getting your location information, your contact information, so that we're able to provide that assistance to you. So my office does answer the toll-free hotline from 9 a.m. to 4 p.m. Monday through Friday. If for any reason we miss your call, we're still operating the home care agency. So if we miss your call, just leave us a message and we'll give you a call back, usually before the end of the day. I know with last week's holiday, it was a pretty long weekend for us, but we were able to respond to all calls on Monday. And just to give you an idea of the call volume that we have been receiving, there have been a total of 780, I'm sorry, it doesn't show me here, but as of the 29th, there have been a total of 780 calls. And as you can see, our busiest day was November 3rd. And then just yesterday was pretty busy. We're starting to get more calls, and it's probably because of the Thanksgiving holiday. As much as we don't like to admit it, COVID is more, it's easier to spread than it was before. So people are saying, I've done everything. I've washed my hands. I wear my mask. I'm fully vaccinated, but yet I still got sick, and I need your help. So, I just want to extend that caution. Please continue to follow those safety precautions and be careful this upcoming holiday season. In the news, you're hearing about the Omicron variant, which is making its way over from overseas, and it's more mutated than the current strain that we're dealing with, and we don't know what that means. We don't know if that means it's going to make people more sick, or if I don't even think you guys can see my screen here. 1 second. Well, there's just a lot of unknowns with the Omicron variant, and I just want to make sure that we're all doing things to protect ourselves and protect each other. But we are here, so if you do need assistance, please give us a call and we'll be happy to help. And I'll go ahead and let Mary share what happens after we get your calls.
Yes, so once we receive the request from the recipients or whoever needs our assistance, we go ahead and do a follow-up call with the requester, and we just confirm that they did put in that request. We have to just get a confirmation on the household size, and just asking if they need any more anything else that we can help them with. And then from there, we go ahead and assign the requests to the teams, and we assign based on the region. And so far, we have received over, well, today, we've successfully fulfilled 238 requests. And like the last live that we had done, I think yesterday, we I just went ahead and shared, when we started was back in September. And so we're on week 14 now. And when we first started, we had 5 requests. We started out really slow, just hoping that, people would hear that what we were doing. But now, since then, it has grown. The average request that we receive per week is like 35 to 40. And as of today, we're actually at 22 requests, and we're only halfway through the week. And so the total amount that we have spent is about $65,500 at this time. And then also the value of the isolation kit is about $400 to $450. And we make sure that we include like whole foods, cleaning supplies, the PPE kits, and over-the-counter medication to help alleviate the COVID symptoms. And so, yeah, that's what we provide. And we have currently 5 teams that help with these the request calls. And it's across Navajo. And luckily, we have a team that's stationed near Hopi, so they're able to cover the Hopi Nation as well. And so I'm just so thankful that we have these teams, and they're able to help us with the direct relief. We also have last month we had the holiday food boxes that we gave out. We gave out over 1,000 boxes, and we collectively worked with 17, we served 17 communities, and we had 10 partners that we partnered up with, and they were able to receive those food boxes. And the good thing about this time around compared to a year ago is the boxes that we gave out were fully assembled, which made it easier for the teams to get those boxes out. So that was really nice. And let's see, we also have the Clean Hands Project. The Clean Hands Project, hold on one moment. Sorry. For the Clean Hands Project, we have, we've given out over 1,000 hand washing stations so far since we started, but right now we're in a phase 3 of giving out the hand washing stations. And we are focusing on the Eastern Navajo Agency side of the Navajo Nation. And so we're working with a Gallup team, Teresa Hatathli, and we're working with the Gallup and Crown Point Service Unit CHRs, and they're helping with that initiative. So I'm very thankful they're able to help us with that as well. So far, we've given out 169 hand washing stations, and we are in the middle of that, and hopefully we'll get all the hand washing stations out in the next week or so. And yeah, if there's anything else that I need to share, I believe that is it. So, but yeah, that is what we do in the direct relief program part of the organization. Thank you.
Mary, I just want to mention to our viewers that this phase 3 of our Clean Hands project, where we're handing out, I think it's about 250 hand washing stations to different households. That's primarily funded by First Nations Development Institute. And then also Verizon was able to fund a few as well. And so we're very thankful to the farmers for those resources. And so we'll go ahead and pass things over to Shandine Herrera, who can tell us a little bit about that frontline experience. So Shandine, do you want to kick us off with that?
Yes, I'm sharing my screen. Can you see it?
Yes, we can see it.
Okay, perfect. Yeah, I wanted to show a few photos from what actually happens on the ground once we receive these requests. So, it goes through Vanessa's amazing team who kind of organizes the calls and sends them out to the nearest teams in the communities. And then we'll hear from Mary letting us know that we have more requests in our area. So my team is located in Monument Valley, and we actually cover a lot of ground. So we also cover Kayenta, Arizona, which is about 25 miles from where we are. We also cover Utah, Navajo. So our deliveries so far have not only been in the Monument Valley, Kayenta area, but we also go out to the Red Mesa area, Montezuma Creek area, Helgaito, Narrow Canyon, a lot of these like sub communities that are really rural. Our team, it covers those. So once we get a request, we make the 25-mile drive to Bashes in Kayenta. So here you can see Mateo, one of our team members, doing the shopping. And so we've been able to generate a really good list of items that households need. And so, everything from fresh produce, canned goods, toiletry items, over-the-counter medicines and vitamins, and like Mary mentioned earlier, it's pretty costly, right? As you can see, we really fill up our baskets here for each family because we want to make sure that they have everything that they need. And so, once we finish shopping in Kayenta, we come back to Monument Valley and we start sanitizing everything. So here you see our table of goods. We sanitize everything and rebox them before we go out on the deliveries. And so once we've reboxed everything, I'll also show you our isolation kit that we also include. So I don't have an up-to-date photo, but we've actually doubled up on all of these items, so each box has a lot of PPE items, thermometers, oximeters for, our recipients to utilize. And so once all that is done, you can see it's getting dark in this photo. This is a really timely process, especially because we're serving families that live, 160 to 120, 160 miles from our site. And a lot of these families are rural, so we've had families who've lived like 20 miles from the nearest paved road. So, we load up our truck and head out for the delivery. And these are non-contact deliveries. So our team, shows up and just leaves these items at the door for these households. And so, when we do have multiple requests, we try our best to respond as soon as we can. So typically if we have 1 to 3 requests, we're able to get them all out in one day. So as soon as the requests come in, we're there within hours. If we have more, I believe one day we had 7 requests. It did take us about 2.5 days to serve all those households. But I think from my experience doing this work on the ground, it's really amazing to see the families and their reaction to us. I do talk with them on the phone once we've completed the delivery, and they're always so thankful and so impressed, I would say, with how quickly we're able to get to them. Many times they've heard about our services, went ahead and put in a request and wasn't really sure what would happen. And then to get a call from Mary or Vanessa or myself, and then to have actual like food and vitamins and everything that they need to combat COVID at their doorstep is just really just amazing to them, and amazing for us to be able to provide that service for them. Before I wrap up, I did want to share a quick story. A couple of weeks ago, we were out shopping at Bash's', and we had 3 requests that day. So it took 3 team members. We're there with our 3 full carts going through Bash's'. And at this point, like, all the Bash's' employees know us, know who we are, know what we need. So it's kind of, just teamwork to get everything there. And we had a lady who was also shopping in Bash's' come up to us, recognizing us. And she was like, wow, you guys are busy, huh? You guys are out here shopping still for families. And we're like, yeah, like, we're trying to help as many families as we can. And she just shared with me how thankful she was. She kind of broke down, sharing that a couple months ago, we actually made a delivery to her family out in Douglas Mesa, Utah. And so she shared, it was her and her husband and her children who all tested positive with COVID, and they didn't know what to do. They hadn't prepared for that. They didn't stock up on groceries like they normally do. And so, she remembered seeing our information about our organization on Facebook and put in a request. And that same evening, we showed up with all these supplies. So she, was incredibly thankful for our organization. Unfortunately, her entire family was able to fully recover from COVID. But, stories like that, it just reminds us why we do this work and who we're helping in this process. And so, that's just one of thousands of stories of families we've been able to help really promptly and effectively. And so, we have really great leadership team, as you all can see and hear from, but we have some really amazing on the ground staff who work really long days to make sure, these families get what they need and feel the support as they, are at home isolating and fighting COVID. So I just wanted to share those photos with all of you and share a little bit about my experience working under our Delta Relief program here in Monument Valley. And so I'll go ahead and pass it on to Cassandra, and she can share more about our PPE program. Thank you.
Thank you.
Yeah, thank you so much, Shandine. I'm going to go ahead and share my screen here. Let's see. Pull up my presentation. Can you guys see my screen? Okay. Okay. So as everyone has mentioned, this is quite the complex, tedious, lots of hard work. Basically, we've become a large supply acquisition, distribution, logistics company. And none of us really had a whole lot of experience doing that. But as you can see, we have quite the creative and innovative team who cares deeply and passionately about our community on both Navajo and Hopi. So last year in November, actually before this, we became very deeply concerned about the lack of access to PPE. Our communities didn't have as much access in terms of access to grocery stores, access to different resources to get their PPE. Ethel talked about this a little bit earlier, how there's very limited stores and just the ability to get access to the PPE. So, the pandemic, the emergency, it all increased the demand of PPE across the United States, across the world. And the crisis also spiked that demand, which only exacerbated the already pre-existing socioeconomic issues that we already had. So this made it very difficult as well to get these resources. And as a group, we just tried to think through how to get as much PPE to our people as quickly as possible to protect them, to keep them safe. Not only did we think about our community members, our most vulnerable, our elders, we were thinking about first responders, the hospitals who are also experiencing challenges with the high demand of services that were needed, not having enough masks, not having enough respirators. I mean, it was just pretty awful, and it was a crisis. And so we got creative and we got innovative, and we were inspired by some friends that we have who were doing this sort of makeshift grassroots PPE pantry. And we said, okay, what if we had a set of revolving distributions, if we could somehow get a supply of PPE across both Navajo and Hopi, because the idea was to allocate resources as quickly as possible, and to cover as much ground as quickly as possible. We realized that our government was not in a position to provide these services. So that's kind of how we started our PPE distribution program. And in each kit, we try to make sure that we're thorough. We try to make sure that we're including items that our community members don't have as much access to. We try to be cognizant. We put a lot of good intention, and we are constantly refining our approach on their assessing their needs, and listening to our community members about what they think is going to help protect their families, listening to them about what was helpful when they had COVID, whether they were exposed, whether they were isolating, quarantined, or infected. So in our PPE kits, we assemble them with our partners. We work with Chinle, we work with many volunteers, we work with many suppliers and vendors and donors across the board. Our followers, our supporters, we use that money, and then we combine it with supplementing from other donations that we receive. So inside a kit, you can see here illustrated that we include sanitizing wipes, face masks, hand sanitizer, oximeters, batteries, thermometers, KN95s, 3-ply masks. And we try to include enough in each kit to help protect a family for two weeks. Hopefully it can stretch to a month, just depending on how many family members are in the household. But we do think about these things on a daily basis on how to make sure we are providing enough supply, that we're addressing the needs, that we're trying to alleviate some of the pressures and just stress that our community members have from not having access or being unemployed and not being able to afford these items for their household. And so very quickly we figured out the acquisitions, the logistics, the distributions of the PPE. We used very strategic partnerships with the support of volunteers, medical suppliers, vendors. We work with Navajo and Hopi leaders across both Navajo and Hopi communities. We work with many organizers. We work with the chapter houses. Here pictured is a warehouse that we have a strong partnership with in Chinle, and Chinle has just phenomenal leadership there, and they let us use their warehouses, their spaces. There's a young team of leaders there pictured that are just energized. They have so much love and compassion and hope within them that they worked tirelessly to be able to help us get this PPE quickly out to our communities. AmeriCorps has been phenomenal. The volunteers there, it's just been very helpful in moving things efficiently. As you can see, it's a lot of hard work. We get creative and innovative on how to move these resources. We used money from the donors to purchase this truck here that we can move a large supply of inventory or supplier resources to the community. And then we figured out and coordinated distributions through our partnerships with BASHAs Bashas' is a grocery chain there on Navajo, and they allowed us to use their parking lots. They allowed us to use some of their spaces within their grocery stores to set up tabling distributions. This was just one of our methods. Then we have drive-through methods that we did extensively throughout that first wave and surge of COVID. And we would just post up in these parking lots, and we figured out a safe way to distribute these contactless PPE kits and distributions. And so it's been quite phenomenal, to watch the mobilization of our creativity, our innovation, the support from donors, the organizing, the coordination. There hasn't been anything that we have been challenged with that we haven't been able to overcome or find some sort of solution. At this point, we have been providing this PPE distribution program for the greater part of the last year. At this point, we have serviced and delivered PPE to almost all of the Navajo chapter communities, and we have serviced or delivered PPE to all Hopi villages on multiple occasions. We've spent well over $2.5 million on PPE. From our supporters, our donors. This is kind of where your funds were going. It's just moving mass resources. We have delivered well over 140,000 PPE kits to all Hopi villages and most of the Navajo community chapters. At this point, we are also working to move supply that we received from Providence, the largest medical supplier in the United States, who donated a large supply of PPE to us. We're moving those resources out. We are focusing on senior centers, our most vulnerable. We're focusing on schools. Right now, there's a major challenge for schools who need additional support and resources. They've reached out to us. We have a process and application that schools can fill out, and we try to fulfill their requests as soon as possible. And then we are continuing to provide PPE to supplement our holiday distributions. At this time of the year, a lot of families are challenged financially with the loss of a job. They're not able to afford food sometimes, right? And again, the PPE. So we try to supplement a holiday distribution with PPE to make sure that they can protect themselves and keep their families safe. This is a program that is very much needed. We have figured out a way to be strategic in partnerships, strategic and efficient in moving these resources quickly. If you know of somebody out there who has access to additional resources, or you just know of additional resources for PPE, we are very much interested in exploring additional partnerships and exploring how we can move those resources out to our community as quickly as possible. I'm very concerned about the Omicron variant. I'm very concerned that this virus is going to be with us for an extensive period of time. And one of the things that's very tangible that we can do and direct is providing PPE. These masks save lives. The sanitizing wipes, oximeters. There have been many times when we've heard from our recipients that I was able to use the oximeter to understand more information about, when I needed to go to the hospital, when I needed to watch and monitor what was going on with me. And so they're very helpful. And many times they have been able to tell somebody who's infected with COVID that you need to go to the ER as soon as possible, just because they were able to gauge with these oximeters. And then the thermometers, they're watching and gauging their temperatures. And then right away, once it hits a certain mark, they're able to get to the hospital as quickly as they possibly. So where these are saving lives, all of these items, we're also providing them in our isolation kits through the Delta Response program that we have. We try to make sure that each one of our team leads across Navajo has access to a certain supply on deck at all times. So when there's a request that comes in for an isolation kit, they have supply on deck and kits with them that include all of those items that I showed you guys earlier, for a family to be able to isolate safely, quarantine safely, use these items to gauge their symptoms and whether or not they should get to an emergency room as soon as possible. So yeah, it's quite a lot of work, and I just want to extend gratitude, gratefulness, thankfulness to our donors, our partners, our vendors, our volunteers. We just appreciate all of you, and this work wouldn't be possible with our leadership here as well. Thank you all for being amazing. But that's the end of my presentation there, and I'll go ahead and hand it back over to Ethel.
Yeah, thanks so much for that, Cassandra. That was really insightful. And so now we're going to talk a little bit about our elder heating program. We had a very successful program last year, and we are, in the works of launching this year's program. So I'm going to hand things over to Teresa Hatafli, our logistics guru, who wears many hats. That's just one of the hats that she wears. So Teresa.
Good afternoon. Shape between initially and she bashes chain to a blind as a chedo to discussion additionally, although a takon hasanada, other a nasha. Thank you very much for today's activity. As Ethel mentioned earlier, I work logistics, and I also, throughout this whole pandemic, majority of it, and I believe I've been part of this whole process since the beginning, before March 15th, the planning process. And so it's been evolving. And as Cassandra mentioned earlier, a lot of the work that we have done, we have explored and learned how the wheels turn in an organization. So it's kind of like building a ship that has sailed, and literally that's pretty much what has happened. For me, what my responsibility was basically, like I said, logistics, but also I organized a seamstress, a huge seamstress recruitment. And during that time, not only did we construct and sew masks, but it also included scrub caps. We've had a lot of medical personnel that reached out saying that my scrub caps, we need scrub caps, and we need to replenish that. And there was such a huge demand for it that we started sewing scrub caps. And then also we started sewing gowns for the medical professionals out there. In addition to that, we also did face shields, and then also booties for the shoes. And a lot of that was just really having to research, and then also taking the initiative to figure out. I mean, for me, I've never sewn a scrub cap. I've had a sewing machine for so long, but pretty much I can only sew a straight line, but I've learned a lot. Figuring out how to maneuver, figuring out how to use different types of tools, and then also going out of my comfort zone and recruiting the seamstresses, and then being able to work with other grassroots initiatives to help funnel sewing machines. Gosh, we've had more than 20 sewing machines that were donated, and then we had to, I had to figure out ways to either mail or to relay that back to different areas of the reservation. along with supplies. And then we've worked quite a bit with an organization that also grew out of need, very much like ours, which is the Auntie Sewing Squad, and then much later Sewing for Native Nations, and then also the Grandma Sewing Group. They also became involved. So all of these individuals, not just ladies, but men, and then also for children, they also learn pretty much that same type of techniques on helping fill the need for Navajo and Hopi. And then I also found out that many of these organizations were pretty flexible with helping us to secure and also send donations. For example, the Auntie Sewing Squad sent thousands of 3-ply masks. They also provided us with hospital gowns, and then also food, and then baby diapers, and a lot of incontinence supplies. And currently I've been working with them pretty much this morning on securing some medication for our COVID relief efforts that's going on, our Delta project out on the reservation. So I also was charged with the elder heating program. So last year we worked with Bear Construction, we worked with Intech, and we were able to coordinate so that we can provide coal to more than 4,400 elders out in many of the communities. So we also were able to coordinate with Coconino Forestry, and we were able to have access to a certain wood pile out there. And so myself included, and many other volunteers came out, loaded up wood, and then they were out there giving it out to elders. And currently we are communicating with the senior citizens programs to identify elders who are in need of wood. So once all of that, all those little areas that can be identified, we can go ahead and roll out our elder heating program. So there's a lot of factors that are in play, but definitely we want to be able to provide more wood out there for elders. In addition to that, one of the other responsibilities that I have, currently we have a Clean Hands program, and then we also have our isolation kit program. And one of the responsibility that I have with that is finding those sales and finding and having access to those items that are needed. Like currently, yesterday, I was like staying up late and hitting those Cyber Monday deals to purchase vaporizers and all the little gadgets that go onto that, which will be also provided in the isolation kits and the quarantining kit. So going forward, I don't see anything that I do that would be any different, but we also were able to purchase the hand washing stations, and then also working with companies also that wanted to donate like soap, and then hand sanitizers and masks, and making sure that they get to where they're needed. And like I said, all of us here, we're just trying to build a ship that has sailed. There's a lot of moving parts, and so to turn around and to get something done can be a little bit more challenging. And then also trying to figure out how our Navajo Nation leadership can also play a factor in all of this. As you know, we have the ARPA funds that became the fiscal recovery funds within the past, since September going forward. Currently, our current leadership is at Twin Arrows. and doing work sessions on how these budget allocations would work out with the planning from OPVP, and then also all the other entities and other programs that are involved. So it's a big responsibility, and I can say that it's very challenging to listen, to understand, but you know, we're trying to make it work. So in this video here, we had a whole crew. This is actually Chin Lee team. And then we've had some teams out there that was working with some medicine men that were that they were providing supplies to. But this here is Chin Lee team. They came out there, I believe it was 6 huge vehicles, and they filled that out, all of those vehicles up, and then we were able to take it into Flagstaff and then dump it at a holding site. And so we went back and forth like 3 or 4 times in one day. So we took out more than 100 cords of wood that day. So very successful. And then just making sure that our elders were being provided the wood that they needed during those cold winter months. So great teamwork, great collaborations, and just continuing to work forward all the time. So that's pretty much all I have. I'll go ahead and turn it back to Ethel. Thank you very much for listening. Thank you for being patient with us, and to all of our donors, thank you very much from each and every one of us. You know, I think that each one of us has an energy, and we each have a light. And then those teachings from our elders that were passed on to us, that inherent intrinsic motivation to go out and make something happen. And we're grateful for your giving that has given us the opportunity to provide for our people. Thank you very much. Back to you, Ethel.
Thank you, Teresa. That was great. And I just want to mention that Bear Construction is Navajo owned. So it's very important for us to support Navajo businesses. Navajo Nation has oftentimes a 50% unemployment rate. And so it's very hard for people to get jobs. It's very hard to start a business and sustain a business here because we just have so many infrastructure challenges, you know, not enough paved roads, not enough internet access. Only 4% of our homes are connected to broadband. And so even people trying to run their business through the internet is very challenging. 40% of our nation is a cell dead zone. So they can't even use their phones in many of these regions to operate their businesses online. And so, or even just, you know, I remember traveling as Attorney General for Navajo Nation, long distances, you know, it takes 5 hours to drive from one side of Navajo to the other side. And so if I was visiting a number of communities, I was trying to multitask and take phone calls while driving, but I couldn't because most of Navajo was a cell dead zone for my Verizon wireless plan. Shandine, you should talk to Verizon. No, just kidding. So there are many challenges to business owners, and the pandemic has done no favor to our Navajo businesses. So one of the things that we're thinking about with respect to our elder heating program is supporting Navajo entrepreneurs who are selling wood, trying to meet ends through their own industry in that way. So that's definitely a conversation we're having. If there's anyone watching from the chapter level, and we have reached out to Navajo Transitional Energy Company. They operate Navajo Mine and asked if we could access coal, but unfortunately we're not able to this year. They were able to work with us last year, which was very much appreciated. But they're routing all of the coal relief through the chapters in the villages at Hopi. So if there is any chapter that needs help transporting coal, we would be happy to work with Bear Construction that has the large industrial vehicles that can make a huge coal haul. So we're happy to work with Bear Construction to get that coal to your chapter, and then the chapters you can do the distribution at that level. That's another possibility that we're exploring. So, if folks have ideas, please reach out to Teresa. She's our lead on the elder heating program. And so I'm going to go ahead, and we've been mostly talking about reacting to this challenge, this threat of COVID in our communities, but we also try very hard to be proactive. And the way we do that, focus specifically on COVID, is through our vaccination campaign. And so I'm going to turn things over to Wendy, who leads that project.
Hello, everyone. Thank you, Ethel. Yeah, in ways of the vaccine campaign is sharing some preventive measures that we can share with our tribal communities. And just to kind of give a little bit of the background, we started our campaign mid-August with funding from Made to Save. And we were able to start with 4 teams that help serve different regions around the Navajo Nation, and 2 teams outreach to the Hopi Nation as well. And so with such teams, having such a vast landscape to provide educational resources, as this is very evident of what we are learning every day, what comes up with COVID-19. And at the start of the campaign, we were sharing with people such information of what is a COVID-19 virus, to when we started seeing the surge happening, to what is a variant, and continuing always messaging these safety measures of masking, social distancing, wash and sanitize hands. And so a lot of this has been very critical to serving the different regions around our Navajo Nation, just because a lot of the information has been provided with, with media. In media, you're able to need to access it, and just sharing with Ethel and saying we only have limited broadband. People really rely on word of mouth, and that's just been kind of our traditional ways. But knowing this pandemic, we can't come together. We can't do our usual discussions as we just have with one another, and updates with family and what's going on with the community. So we had to find a lot of ways to public outreach, information about about vaccine, and we were able to find areas with one-pagers, tribal influencers, newspapers, radio forums, and still integrating social media. And when I say public outreach, we're not just excluding those who are unvaccinated. We're encouraging that bridge to help start a conversation, because this is big topics to understand, especially dealing with your health, and us sharing resources of clinic hours, clinic areas of where they're offering such vaccinations, and currently with boostering. So it's been very critical to have such a great team who has all the in and outs of their own community regions, and us just trying to share what we can with updated information about the COVID-19 virus, and aspects of what happens with our health, and all these new tools we're able to access with vaccines and boosters. And so we started with the campaign in some outdoor public spaces, but that was, again, the beginning before numbers went up. And then we pivoted over to phone banking, and our future areas to focus on is to doing some safe canvassing. And such places help provide flyers that give information, as Vanessa shared, of the phone numbers, of the web address, of wanting to have us call you to share the vaccine information and sources. Because with such information, we help provide rewards for protecting your community, and such rewards are the pictures you're seeing are those beautiful t-shirts that have been designed by a native artist, Jared of OXDX, and we were able to offer bumper stickers that have information in Navajo and English. And when I shared about social distancing, we had a nice cute picture of like a grandfather and a grandson, like two sheeps apart, because the sheep is like 3 feet and two of them are 6 feet. So it's been a lot of creativity in sharing visually, you know, that we need to do our best in storytelling this very important aspect of what COVID-19 is and areas of vaccination. And so we want to continue with current one-pagers that we call really beautiful storytelling about the Delta. What is the Delta vaccine or Delta variant, I mean, and with vaccine education. And so we're going to continue and help reach out to our children, because as we know, that is another big opening with having vaccinations provided to 5 years and up. And the current topics right now is sharing about boostering and offering such rewards for protecting our community and giving that booster shot, because we're always trying to establish this halo around our people we love and family and friends and just in our tribal nation, and just keep increasing our vaccination rates, because we know that is our protection. And so rewards with this program is just the outreach we have, hearing stories from our team members that reach out to the community members through the phone banking, and even before when we were doing outdoor tabling, and just seeing that human connection that we can still have, whether it's digitally through a phone line, or even just, you know, seeing that print in Navajo, because it just shows we're all we're still here together and moving forward together in our strength and healing with all what we're learning about with COVID-19. And so stories of just that strength that we carry definitely always hits us in our heart, and just people sharing thank you for helping me understand this, or thank you for the reward I received, because a lot of our what we're able to provide is sent in the mail, because, you know, we're just practicing all the safety measures as we can. So those little parts just mean a lot. And currently we were able to reach out to at least 500 people with such rewards with protecting their community. And we offer such like the t-shirts, the bumper stickers, bracelets that say I'm vaccinated, to posters that just share all these influencers of our tribe that share pro messaging for vaccination. And so it's just a lot of good items there. And it's just really been nice to be helping lead this effort, and knowing that we are in the second cycle of again, like I said, reaching out to our children in promoting the vaccine campaign with them. So yeah, I just want to give an all around thank you to all our team members for the vaccine campaign, to our own organization, to funders, to our grant for Made to Save. It's just been overwhelming, and ideally we wish we didn't have to be in this, but we are. But we know with our tribal members, knowing that the messages come with us with good heart, they truly understand where we come from. So yeah, thank you.
Yeah, Wendy, that was really wonderful. Thank you so much for sharing that. And I also want to give a and Aswali to some of our other donors You can see Vanessa has her company logo in the background. Ahihet Shidineh. She provides home care services through that company to community members on Navajo Nation as well as Gila River Indian community. And they have just been so giving in terms of the resources, their staff time. She mentioned her staff operates our hotline, and they pay for our hotline, and have just always been so generous to us. And so we're just so thankful, Vanessa, to you and to your company for the great generosity that you have shown to our people in protecting our community. And then we also, Cassandra mentioned Providence. I mean, the donation that they've given, they've sent us semi-loads full of donations in terms of PPE. So it's massive amounts of hand sanitizer, 3-ply masks, sanitary or disinfectant wipes. So that has gone a long ways to protecting our communities. And then of course, Chinle chapter providing us with the warehouse space and staff, their AmeriCorps team, and Walton Yazzie in particular, who is just this phenomenal chapter manager and runs a really tight ship, is very innovative. During our food relief program, they were doing multiple food distributions every week, serving all of Central Agency, which is a huge area. And so they have been very instrumental to our overall relief effort, and of course are still helping us with assembling our PPE isolation kits and getting those out to our teams all over Navajo Nation, and also doing the Delta response at the ground level as well. So I just wanted to give some additional thanks to those folks. And then also just to note, we are fundraising right now. It is the end of the year and it's the winter. We have Delta surging very much so in our community. Omicron is now in the United States, and that is poised to be even more highly transmissible than Delta variant, potentially is more aggressive than Delta variant, so we're still learning about that variant. I don't know if Cassandra wants to give us a brief update on what she's learned, but I know it's sort of like breaking news, right? Cassandra, do you
Yeah,
want
no problem. Yeah, Ethel, I'm just, as we were having this discussion, it looks like it's breaking news right now. I'm getting my information from Centers for Disease Control and Prevention. So it appears, today the first detected case of the Omicron variant was detected in California. And the individual was a traveler who returned from South Africa on November 22nd. This person was fully vaccinated and had mild symptoms that are improving. They're self-quarantining right now, and has been since testing positive. Everybody who came in contact with this person has been contacted. So it looks like the University of California is doing some genomic sequencing right now. And they did confirm it was consistent with the Omicron variant. Yeah, so it is in the United States now, first detected case. And I don't know, they don't know much about it, so we'll just continue to watch. This is something we had our eye on for some time, and we've been trying to track data. We've been trying to see what's going on in other countries. We've been trying to understand data in our own communities. I think, this is something that could be have a huge effect and impact on the economy and communities. Again, it's very concerning. But yeah, it does look like it is stateside, unfortunately. Not much is known about it. Delta is still the predominant strain, but like you said, Ethel, it's showing that it's spreading pretty quickly, so a lot more transmissible. Wow, we knew this was coming. We knew this day was coming, and just in general, I think the boosters, the vaccinations, it's very important that we continue to utilize those resources. Otherwise, I feel like this virus is going to continue to evolve, get stronger, mutate, and vaccinations are one of our defense mechanisms. So very concerning.
Yes, definitely. Well, they're our strongest defense mechanism. They're saving lives. And masks are also extremely effective. They can prevent the spread by 30%. So, make sure that you are fully vaccinated, are boosted. You can expect to see many more boosters coming. Moderna is already looking at a booster targeting Omicron. So we can expect that will be available probably in the next quarter. So we all need to get used to this, particularly if we still have almost half of our population that remains unvaccinated. And that is the case with Navajo Nation. Only 58% of Navajo residents are fully vaccinated. And that is, that's worse than the US's vaccination rate. And that is not a very good vaccination rate. So we really need to make sure that our community is getting fully vaccinated, because the virus is moving rapidly among the unvaccinated. It's seeking out the unvaccinated. And because we have so many people in our community who are unvaccinated, that creates more opportunity for the virus to attack people who are fully vaccinated and boosted. And so, anyone who's not vaccinated, you are creating a risk for everyone, including people who are fully vaccinated and boosted, especially our most vulnerable. That's our elders, folks who are immunocompromised, who have diabetes, high blood pressure, are obese, and many people in our community, unfortunately, suffer from those health conditions. Our nation has been a national sacrifice area to this country for almost a century. We have over 1,000 abandoned uranium mines on our lands, most of which remain unremediated. That poison spills into our watershed. Our livestock is drinking from contaminated pools. Our people are eating that livestock. Our people are drinking water. 11% of our wells are contaminated with radiation. People don't have other water sources. People who don't have running water don't have alternatives, so they are drinking that water in many cases. So, in order to protect our community, it's very important that people get fully vaccinated. Everyone, even if you're young and you don't think that you're at risk, you are creating an access point for the virus. And it is just a matter of time until you do get COVID. So it's very important that everyone get vaccinated. And again, the vaccine is saving lives. Young, healthy people are dying from COVID rapidly. My son's oldest brother, who was very young, early 30s, very active, very strong, he got COVID and he's gone now. So I urge everyone to please access the vaccine. Does anyone want to add anything before we wrap up? Okay, well, one thing I do want to add is that, if people are giving to us through GoFundMe or through an individual check, I just want to be clear that, those donations are going straight to direct relief. We do have foundation funding that helps cover other aspects of our work, such as our staff time, as well as the equipment that we use. For example, the beautiful trucks that you saw that we use to transport items. I'm going to go ahead and flash those back up on the screen. Many of those were purchased, including that box truck, as well as the mini refrigerators that we now have in our inventory. Those were purchased through a $100,000 grant from the McGovern Foundation. So we're very thankful to the McGovern Foundation for that. The balance of these vehicles were purchased through the generosity of Mackenzie Scott. So we're very, very appreciative and thankful to her for those donations. And so just wanted to note that if you do give to us as an individual, your money is going straight to direct relief. And of course, you guys are the core of our effort in terms of being able to mobilize. So we are very thankful to all of you, and also very thankful to all of the foundations that have donated to us. For example, the Vadon Foundation has given hundreds of thousands of dollars to us to provide food to our communities, University Impact as well. The Kellogg Foundation, many folks have, this is really an all hands on deck effort, whether that's the volunteers, our staff, and just the giving, beautiful hearted people of this world, making sure that our communities are safe. And unfortunately, we do remain disproportionately vulnerable because of this legacy of contamination and the underlying health conditions that can be traced back to that legacy. And so, thank you everyone for what you've done to make this effort a success, not only in the last year and a half, but going forward. We're very, very appreciative. We are looking for vehicles. If you're able to donate a vehicle, we especially need four-wheel drive pickup trucks because we have many dirt roads. 15,000 of our 18,000 miles of roads on Navajo Nation are unpaved. So most people live on unpaved roads. And so we did receive a donated van last year, and we are in the process of refurbishing that. That's Big Bertha. She's going to be out there getting food and PPE to families. Shandine, I don't know if you want to do a shout out to the donor on that. But we're very, very thankful for that donation. Okay.
I don't, sorry, I am totally blanking on the name, but it was a family out of Colorado who actually last winter donated to our winter clothing drive. So they donated a lot of children's clothes we were able to distribute. And they actually drove down in that van from Colorado and met us in Kanta. And so shout out to them. It's really amazing to just see that generosity play out.
Yes, absolutely, absolutely. And just so folks have a sense for where we are on Navajo Nation, in May of 2020, we were making national headlines because we surged ahead of all other jurisdictions in this country in terms of the high transmission of COVID in our community. And as of last week, we were 6th in the nation. So unfortunately, we are rising again very quickly in terms of our COVID contraction rate. New Mexico is actually 3rd. And so, whether it's, knowing that your money is going to a worthy cause, or if you are at home unvaccinated, please get vaccinated, because we don't want to keep rising. We don't want to be known for this legacy of high transmission of COVID in our communities. And we want to make sure that the hard work that our elders and our young people are doing, we have children that are stepping forward with a sense of duty and love for their community and taking the risk, minimal risk of getting vaccinated because they want to protect their elders and their parents and their entire community. If these children can be this brave, surely all of our adults can also step forward and serve our people and our nation as a country by getting vaccinated. So please, and also check on your loved ones and make sure that they are fully vaccinated and boosted. So ahiha, everyone, have a beautiful rest of your day. Have a beautiful December and winter solstice. And I'm going to open it up if any of our other team members want to also give a final goodbye for today's session.
I think we're all being shy right now. Yeah, I just want to say thank you for spending time with us this afternoon. Thank you for hearing about our updates and where this effort is going and the work that we're continuing to do on a daily basis. So thank you so much for your time. Yeah.
Okay, great.
Yeah, thank you everyone for joining. Thank you for continuing to show up in this space with us over and over again. Many of you sometimes donate something as little as like $5 and it goes such a long way. Like, want you to know that we see you. Your $5 means everything to us. We know that things are tough right now. So even a small incremental donation like that goes a long way. So we appreciate that support, and just want to encourage everyone to continue to protect your families, protect yourselves. We all want you to live a happy, long life. We all deserve that, and we can do that together. We can help protect our elders, our families, our brothers or sisters, our friends. And so just continue to be consistent, and we'll try to pull through this together.
I just want to add, just express appreciation also for everyone who's listening, who gives us this platform to provide a message for all of our relatives and throughout Navajo, and then also our neighbors, the Hopi tribe. And so we do have many intermarriages. We have children that we greet that are Hopi and other tribes also. So I think that overall there's a sense of kinship all the way across the nations. And we certainly have a lot of commonalities as far as the disparities that we have faced and the hardship that we have. We all know that. And so we understand that also. So, but all across the board, just that sense of kindness. And then also every day having that prayerful thought and that prayerful way of life, the spirituality that we each have. And I'm pretty sure that there's many denominations that are out there that speaks that truth to us on a daily basis. So from that point of view, I just want to say thank you. And every day we're constantly having those prayerful thoughts, and everything that we do, we always have a prayer that goes along with it, so that one day we will see our grandchildren, that we will be able to provide some sense of security and stability for them too. So thank you very much. Yeah, back to you, Ethel.
I just want to give a quick thank you to our healthcare professionals and everyone that has been helping all our tribal communities, because I know it's not just the hours you go to work, you're extending so much to our health of our people. And so I wanted to say thank you to everyone in there, and just the listeners and our funders and MTS and Made to Save. And we're all in this together, and we can vaccinate and help protect ourselves and our people we love. So again, thank you.
And I just want to say thank you to everybody. You know, even if it's from locally, if the best thing you can do is share our information out there, continue sharing the information that we're providing to your communities, and just be consistent and don't give up. I know it's, there's times where you see information or content that'll discourage you, but just continue sharing information for us. And we appreciate everybody that's supporting us and, allowing us to do this work. This is a really big task here that we have taken on. And really, none of it would be possible if it wasn't for each and every one of you that have been with us on year 2. So it's something pretty special and pretty big that we're taking on. And, so I just want to say thank you. Yeah.
I'm sure our little sister wants to say something. Shaheen.
Yeah, I mean, just to echo everything, yesterday was, the end of November, and I was thinking how it's been 21 months of doing this work. And so it's both been a very long and tiring journey, but it's also just been, so amazing to see our impact in, the short 2 years. So I just want to, again, just echo the gratitude. Thank you to all of our donors, all of our supporters, and, and everyone who uses their platform to share our messaging. And share our stories and the work we're doing. It's really makes a difference, especially for me, and being able to see the day-to-day work and the people, to actually see the people that we're helping. It just is incredible. So a big thank you to everybody. And I'm just really grateful to continue doing this work with all of you amazing women who continue to inspire me every day. So I'm very blessed to offer what I can to this amazing organization. So thank you again to everybody.
Thank you. Well, thanks everyone. We're going to go ahead and sign off now. Go forward in beauty, and have a beautiful day. Yeah.